Actually, what often happens is that reflux esophagitis gets worse because of the medication. Some medications used to lower blood pressure, as well as certain drugs for treating nocturia or overactive bladder, can actually make reflux esophagitis worse. Good morning, this is YouTube Medical University. This time the video is about lifestyle habits and eating habits you should avoid for reflux esophagitis. Reflux esophagitis. Heartburn can be tough, and when you lie down, you might feel a sour liquid coming up, which is uncomfortable. There are many people who visit the outpatient clinic because they're troubled by those kinds of symptoms. There are 15 million people in Japan. More than 1 in 10 people suffer from these kinds of symptoms, but over half of them have trouble controlling their symptoms, and many find that their symptoms get worse unless they keep taking their medication. A common situation is that people feel better when they take the medicine prescribed at the clinic or over-the-counter stomach medicine, but once the medicine wears off, their symptoms gradually get worse again. I think there are many people like that. It's true that over-the-counter medicines like Gasutaten, Otaz Isan, Sucurado G, and Ashanon are effective for reflux esophagitis, but actually these are not a complete cure. And the stomach medicines prescribed at hospitals like Lansoprazole, Nexium, Takipron, and Pariet are also drugs that suppress stomach acid secretion. I often prescribe them myself, but these are not treatments that address the root cause either. The medicines only suppress or neutralize stomach acid. They don't actually prevent the reflux of stomach acid itself. Actually, I myself have suffered from the symptoms of reflux esophagitis, but now I can control my symptoms without medication by improving my lifestyle and eating habits. It's said that if you leave this reflux esophagitis untreated, it can increase your risk of esophageal cancer, so I hope you'll watch this video until the end and that your symptoms will improve even a little. On this channel, I provide clear, evidence-based information from a doctor's perspective, as someone who works in an outpatient clinic and routinely diagnoses reflux esophagitis with endoscopy. I'm sharing videos to help you get healthier starting tomorrow. Please subscribe if you're interested. There is data showing that by putting into practice what I'm going to introduce today, you can cut your risk of reflux esophagitis in half, so please listen until the end. First, I'll briefly explain why reflux esophagitis occurs. Then I'll go over 4 lifestyle and dietary habits that make it worse. And finally, I'll explain 5 lifestyle habits that can help improve it. Reflux esophagitis, simply put, is when the liquid called stomach acid in your stomach flows back up into your esophagus. This stomach acid is actually more acidic than a lemon, and humans secrete about 1 to 2 liters of it every day. Stomach acid is mainly hydrochloric acid. The stomach secretes a sticky liquid called mucin that protects the mucous membrane, so even when exposed to stomach acid, the stomach is fine. But if this flows back up into the esophagus can't protect itself from stomach acid, so it gets inflamed, and that's what is called reflux esophagitis. This is actually an endoscopic image of a person with reflux esophagitis. We're looking at the esophagus from above, and you can see these red lines stretching out. This is evidence that the esophagus is irritated by stomach acid. So why does stomach acid flow back into the esophagus? Actually, many people also have something called a hiatal hernia. Between the esophagus and the stomach is the diaphragm, and in that area there's a muscle called the lower esophageal sphincter that keeps the esophagus closed. However, when this muscle becomes loose and the stomach shifts upward a bit, which is called a hernia, it makes it easier for stomach acid to flow back up. This condition is known as a hiatal hernia. You might not have heard of it very often, but actually it's said that 40% of people have a hiatal hernia. In fact, I was also told that I have a hiatal hernia. So for people who have a hernia, stomach acid tends to flow back up more easily, which makes the esophagus more likely to get irritated. That's the reason behind it. Because of that, some people suffer from symptoms like heartburn or a sour taste coming up, which is called acid regurgitation. Other, less common symptoms include coughing, a sore throat, or pain around the pit of the stomach. Of course, not all of these symptoms are necessarily caused by reflux esophagitis, so when diagnosing reflux esophagitis, I always recommend checking the junction between the esophagus and the stomach with an endoscopy. However, there is one thing to be careful about, which many other YouTube videos don't explain. There is a type of gastroesophageal reflux disease where the esophagus doesn't appear inflamed on an endoscopy. This is a condition where stomach acid is refluxing, but the esophagus isn't inflamed, or symptoms occur because the esophagus becomes hypersensitive. This is called NERD, and just because an endoscopy doesn't show any abnormalities, it doesn't mean that the symptoms aren't real, or that it's all in your head, or that you're faking it. Please remember that symptoms can appear even if there are no visible findings. Now, let me introduce 4 lifestyle and eating habits that can worsen reflux esophagitis, which you've all been waiting for. Here is the first of the 4 lifestyle habits that can worsen reflux esophagitis: carrying heavy objects or putting pressure on your abdomen. This is simple. When your abdomen is compressed, the pressure inside your abdomen increases, making it easier for stomach acid to flow back up like this. Also, when you lift heavy objects, you strain your body, which raises the internal pressure in your abdomen and makes it easier for stomach acid to reflux. It's not easy to avoid carrying heavy things, but you can ease your symptoms by making small adjustments, like dividing loads into smaller parts, loosening your belt by 1 notch, or loosening your belt when you sit down. Here is the second of 4 lifestyle habits that can worsen reflux esophagitis: sleeping on your right side. The reason for this is because of the shape of the stomach. If you look at it from the front, this side is the left and this side is the right. When you lie on your left side, you can see that stomach acid tends to collect on this side. But if you sleep on your right side, the stomach shifts like this, and it's said that the stomach acid that was here can suddenly flow back up. So, there are people whose symptoms improve if they avoid sleeping on their right side at night. Please give it a try. Here's the third of 4 lifestyle habits that can make things worse: obesity. It is said that people who are obese with a BMI over 25 have a higher risk of developing reflux esophagitis. BMI is a value you get by dividing your weight by your height twice, but make sure to convert your height from centimeters to meters. If your height is 150 centimeters and your weight is 50 kilograms, your BMI is calculated by dividing 50 by 1.5 and then dividing that result by 1.5 again. When your weight increases, abdominal pressure rises, raising your risk of reflux esophagitis. Here's the 4th lifestyle habit that can make it worse: eating habits. I'll go over everything briefly, but to get straight to the point, eating habits that worsen reflux esophagitis include coffee, chocolate, carbonated drinks, alcohol, and citrus fruits. Coffee, chocolate, and alcohol are said to worsen the condition because they relax the muscle between the stomach and the esophagus. Of course, I also love sweets, and it's not like I don't eat them at all, but when my symptoms are severe, I try to cut back a little. And as for carbonated drinks, they create fizz and gas in your stomach, which makes you burp. Stomach acid can easily flow back into the esophagus, creating a risk. And why are citrus fruits a problem? Citrus fruits are actually acidic themselves, right? So when you put something acidic into your stomach, it irritates the esophagus. That's a direct reason why it increases the risk of reflux esophagitis. By the way, besides citrus fruits, tomatoes are also acidic, so you need to be careful with them. Other foods to watch out for are spicy foods. Have you ever had an upset stomach after eating spicy food? Similarly, data shows spicy foods can irritate the esophagus and worsen symptoms. Now finally, here are 5 lifestyle habits to help improve reflux esophagitis. The first one is this: sleeping with your head elevated. This is pretty straightforward, isn't it? When you lie down, your esophagus and stomach are parallel, making it easier for stomach acid to flow back up. By raising your head or upper body a bit when you sleep, gravity helps keep the stomach acid down, making reflux less likely. For those who really struggle with symptoms, many people find that placing an extra blanket under just their upper body when lying down at night or using a slightly higher pillow can help control their symptoms. This is particularly advised for those with worse symptoms at night. The second of the 5 lifestyle habits to improve reflux esophagitis is this: sleeping on your left side. This is also for people who have symptoms at night, but it's not good to sleep on your right side. It's also said that sleeping on your left side helps improve your symptoms. The reason is that on the left side, there's more space for the stomach, so when you sleep on your left side, stomach acid tends to collect there and is less likely to flow back up. However, when you're sleeping at night, you tend to roll over, so I think it's difficult to sleep only on your left side. Well, if there's something you can do, try to sleep on your left side and put a pillow or blanket here to keep yourself from turning to the right as much as possible while you sleep. I think you'll spend more time sleeping on your left side, so if you're troubled by symptoms at night, please give it a try. Now, the third of the 5 lifestyle habits to improve your condition is this: don't lie down right after eating, and don't just eat and sleep. If you've experienced it, you know symptoms appear if you lie down after eating. So what kind of data do we actually have? There is data showing that if you avoid lying down for 2 to 3 hours after eating, your symptoms are less likely to get worse. I know many of you are busy and end up eating dinner late. Try to plan your dinner so that you don't lie down for 2 to 3 hours after eating, or avoid taking a nap right after a meal. Please be mindful not to lie down immediately after eating. Now, the 4th of the 5 lifestyle habits to improve your condition is this: don't smoke. This might be surprising, but actually, smoking can also cause the muscle between the stomach and esophagus to relax. Smoking is relaxing, so I think it's good to remember it like that. If you smoke, actually, reflux esophagitis can get worse, and of course it also increases the risk of esophageal cancer and lung cancer, so quitting smoking can improve heartburn symptoms and also reduce the risk of other cancers. If possible, please consider reducing the number of cigarettes you smoke or quitting smoking altogether. Now finally, the fifth lifestyle habit to improve reflux esophagitis is this: have your doctor review the medications and supplements you usually take. Actually, what I often see is that reflux esophagitis is getting worse because of certain medications. Some medications for lowering blood pressure, as well as certain drugs used to treat nighttime frequent urination or overactive bladder, can actually make reflux esophagitis worse. Patients prescribed these medications often don't realize their medicine could worsen reflux esophagitis, so they usually don't mention it or ask about it. When a patient comes in complaining of heartburn, it's not uncommon for me to realize that the medication I recently prescribed might be the cause, so I recommend reviewing your medications to see if they might be causing your reflux esophagitis. And finally, to briefly explain the process of diagnosing and treating reflux esophagitis when you visit the hospital, basically it's important to have an endoscopy. Other diseases besides reflux esophagitis can also cause heartburn or upper abdominal pain. Malignant tumors like esophageal or stomach cancer are especially concerning. It's common practice to check for those conditions and to see if there are any signs of inflammation in the esophagus before making a diagnosis. If you strongly prefer not to have an endoscopy and have these symptoms, diagnosis and treatment can sometimes be started based on symptoms alone. Please consult your primary doctor about whether an endoscopy is needed. And when it comes to treatment, the most important thing is to take your stomach medicine properly. Proton pump inhibitors are the most common medication, but it's important to take this kind of medicine properly for 8 weeks first. And on top of that, you should try to improve your lifestyle habits as I mentioned earlier and see if things get better. If it still doesn't improve, sometimes we use double the dose of the stomach medicine. This is not a special method, it's a treatment that's also described in the diagnostic guidelines for gastroesophageal reflux disease. If it still doesn't get better, surgery may be considered. And when you gradually start to get better, it's common for things to get worse again if you stop taking the medicine. So there's what's called on-demand therapy, where you get a certain amount of stomach medicine prescribed and you take it when your symptoms get worse, then stop taking it when you start to feel better again. There's also this on-demand therapy where you adjust and take the medicine yourself, and it's common to gradually reduce how often you take the medicine with on-demand therapy, eventually leading to a complete cure. And what's important for achieving a complete cure are the lifestyle and eating habits that I talked about in this video. So, how was it? This time, I briefly explained the mechanism of reflux esophagitis, the lifestyle habits that worsen it, the habits that improve it, as well as its diagnosis and treatment. These are painful symptoms that can interfere with your daily life and work, so I hope this information is helpful and that your symptoms will be relieved even just a little. Lastly, let's review. Reflux esophagitis is a condition where sour stomach acid flows back into the esophagus, and in many cases it's caused by a hiatal hernia, which means the area between the stomach and esophagus has become loose. And as for lifestyle habits that can make it worse, I mentioned carrying heavy things, putting pressure on your abdomen, sleeping on your right side, being overweight, and certain foods. I also talked about coffee, alcohol, chocolate, carbonated drinks, and citrus fruits. For helpful lifestyle habits, I suggested elevating your head while sleeping, lying on your left side, not lying down for 2 to 3 hours after eating, quitting smoking, and consulting your doctor to see whether your medications might be causing it. How was it? It was a long video, but thank you very much for watching until the end. I'll keep sharing data and easy to understand videos from a clinician's view to help you get healthier starting tomorrow, so please subscribe to the channel to stay updated. If you liked this video, please give it a thumbs up and comment. See you in the next one.